everyone, welcome to my YouTube channel. This is Pari and I'm here today with Miss Judith Fasone, who is a health and wellness nurse coach. In addition, she is a Trager Practitioner and she's been practicing for the last 22 years with a private holistic nursing practice, and she's also a certified advanced holistic nurse. Welcome, Judith. How are you?
I'm good, thank you. I'm learning a lot about video conferencing. Thanks for initiating this call.
Thank you very much for being with us today. And then today we'll be talking to her about the use of alternative intervention in nursing, in addition to role of nutrition, wellness, and exercise in your overall health, and then importance of getting certified in alternative approach as a medical professional, or in general overall information, how we can do that. So let's start with Judith, about what is a Trager Practitioner approach that you also practice in addition to holistic nursing overall.
Yeah, I was fortunate to be able to learn about alternative care at the same time that I was being trained as a nurse. I started out with an associate degree certification in nursing, and during that time period, I had put my hands on somebody and they told me I was doing Reiki. And I said, well, I don't even know what that is. And so I started to research some alternatives for myself. And in the process, I found a colleague of mine that was doing the Trager Approach. And so she gave me 3 sessions. I was a single mother. I had 3 children under the age of 5 at the time, and I was putting myself through nursing school. So I was very in need of care for myself. And I learned this approach in the course of about a year. I was still enrolled in nursing school too, and got trained, and then I was able to begin to do practice sessions on people. And over time, my training in nursing has paralleled all of my training in this Trager approach. And the Trager approach was started by Milton Trager, who was a physician out on the West Coast.
Okay.
And he actually felt like we could reach somebody's unconscious mind when we got them in a really relaxed state. And so the work is very gentle, non-invasive. People are fully dressed. We can have them sitting in a chair if they're not comfortable lying down. There's a lot of movement involved in this. And so I watch people move. I suggest ways for them to move more freely and easily in their body. And for a long time as a nurse, I felt like I could not do Trager where I was nursing. And I also, doing my Trager sessions, I didn't feel comfortable doing private practice as a nurse. And so in the last, I've been doing it 22 years now, and I finally have found a way to bring them both together. They do work perfectly together. And I am fortunate enough to have a practice that now, because I wanted to get more certification for my nursing, I got a coaching certification that allows me to be in private practice and do the Trager approach and help people with their health issues. So it's kind of a story that has been ongoing for a very long time.
Yes. So my next question is, very interesting background you have with 22 years of doing this. So which leads me to, how is this approach different than other forms of alternative practices?
Well, this is movement. It's really focused on movement. And nurses are familiar with passive range of motion when we work with our patients.
Yes.
There's a lot of that in the Trager approach. When the person is laying down on the table, that aspect of it is I'm doing all the movement of their body parts. But in the beginning and in my assessment, I watch them move and I suggest ways for them to move more freely. And so it's very active in that sense. And the whole focus of my work when I am at the table is to be in my full body, my integrative self. So that movement that I'm doing with somebody's arm while they're laying down actually comes from my feet. And that feeling that I can give someone, that whole body feeling that goes then into their shoulder or into their wrist or into their neck or wherever I am, actually is a very integrated feeling. And I'm watching it move through their body also. I'm not just working with their hands on a little part, with their fingers or whatever. I'm actually elongating enough so that I'm connecting to the whole structure. And so every action that I do is connected to the whole. It's my whole body to their whole body. And it's a very different feeling. It's very deeply relaxing, and it provides safety, because I never go beyond their limitation, and I never go beyond my own limitations.
Keep it safe in that sense,
Yeah.
knowing together working with the client and figuring out a solution together. And so I wonder about, so what you come across as a Trager practitioner in the sense of the common illnesses and ailments that people come to you to get help for?
Yeah, so a lot of times people have emotional holding that they can't move. They feel they're sad all the time, or they want to work through a relationship they can't let go of. And so the work is very much about letting go. Letting go of tension in our body helps us let go of tension in our relationships. Learning to communicate with me about what they want specifically while they're on the table can help somebody tell somebody else in their life what they need. So for me, there's three aspects of it. It's communication, it's movement, and it's touch. And these are basic human needs that we have to express ourselves. And so person might have emotional holding patterns. They might have been told by a physical therapist that there's nothing more we can do for you. You're always going to have a hitch when you walk. Your hip, your legs are different. You're always going to have this. And so I work with a lot of people that are kind of at the end of their medical help, and then they find that what they were told was not true. That they can rewire the nervous system and the nerves are connected to muscles. So
that's true.
Neuroscience now tells us, this neuroplasticity that we have, we can rewire our system to have more engagement in our life and move beyond some of those older holding patterns that have been limiting our potential.
Okay, so when you with these different ailments, is there a certain particular person that you are apprehensive to see, or are there any contraindications to the holistic and Trager approach that you provide?
Well, I have a lot of psychiatric background. That's my traditional nursing roles that I have played, mostly public health and psychiatric mental health, and then holistic health. But if somebody is in a psychotic state, I certainly would not work with them, because they misinterpret things. Basically, as a student of the work many, many years ago, there were some limitations that we were asked to respect in terms of people who were pregnant, or a person that might have been very severely ill. A person with a rash, we wouldn't want to put our hands on. But as I've grown into my practice and as a nurse as well as a practitioner, I really don't have very many, times where I need to turn somebody away. There are always parts of the body. If somebody has a rash on their arm, I can work with the rest of the body,
True.
So it really takes the skill of interviewing and assessing, and this work is very much this mutual agreement, and making sure that I'm getting input and feedback as we're going along. But I guess for somebody that might be in a state of psychosis, or somebody that's heavily drugged, I would not touch them. And this is an issue for people in pain, because I don't want to work with somebody that's taking heavy pain medications, because they're not going to really feel the reality of what I'm doing. And I might overstimulate them, so there's a possibility that could happen. So I do let people know that it's, I'm not talking about aspirin or over-the-counter anti-inflammatories. I'm just talking about like
the narcotics. And...
Yes, yeah. So that, I guess that would be a contraindication. If they can't live without those kinds of drugs, then probably they need more help than what I can give them right then. But I've never really ever run into that. So.
Mhm. So you did mention about the importance of what is the role of nutrition, exercise, and health in the overall well-being from a holistic nursing approach. I was just wondering, what are your thoughts on that?
Well, health and wellness are complicated in a way, but if we take it back to the basics, which is nutrition, movement, social support that's positive, a clean environment, and our spiritual life, those 5 things are the basis of any traditional healthcare system, whether it's Chinese or Ayurvedic or functional medicine. All of these things are necessary for health. And so as a coach, I spend time doing a very broad assessment, and the person that I work with does a lengthy self-assessment. And then we look at that together, and through this, we actually come up with goals that are important to them. And then through a period of maybe 10 sessions, weekly sessions, or every other week, depending on what they want and what they can afford, we would just specifically narrow down to goals that we think we can be successful with. As if you're trying to work on a goal that's too big, it's going to just not work. And so little steps, you know, people want to lose weight fast, but honestly, 1 to 1.5 pounds a week is healthy. And that can be sustained over time if you change your involvements in movement, your interactions with people that think like you do, that really want to be healthy. If you look at your food and you start cooking more for yourself and not eating out. So the behavioral aspect of this is the thing that often people get hung up on. And that from a coaching standpoint is really what we're looking at, is what motivates the behavior and how can we celebrate small steps and set goals.
Yes. So just kind of like it's a working progress. It's not just like a one-time session and there's a quick solution. It's you have to constantly work with the person, the client, and the client has to be willing to follow the directions as given by you to make the necessary changes to improve their health. Right.
And so the direction comes from the client, not from me. And so that makes it easier for them to do it because it's actually their idea. We often resist authority, and the truth is nobody knows better than we do what's good for us. And I turn that totally over to them. What I do is facilitate their goal setting and help them to be honestly self-assessing to the ability that they have to do that, and get permission from them by asking for their willingness to let me interact with them. So it's a continual conversation about, you know, how can we work together here? You know everything you need to know, but maybe I'm here to help you find out what's blocking you from your success. So that's the coach's role.
I see. So I see that you find that it's important for other you mentioned that it's important for all healthcare professionals or nurses to get involved in getting certification on alternative approaches. Can you elaborate on the importance of being certified?
Yes, I was fortunate to work for the last 10 years in teaching nursing in an associate program, and I was allowed to create a holistic course for these nurses, which is really unusual at that level. Because they're so focused on getting all the information that nurses need to know in 2 years. And then we were adding this holistic class, which I felt was really important to help the nurses at the bedside become more confident touching people and really assessing and palpating and being themselves, you know, being honest with where their limitations are, even in feedback with clinical evaluations and those kinds of things. You know, if you don't have a nurse that can say, I don't really know what I'm doing here, that's the first step towards a big problem later on, right? So we want the nurses to be able to say, I need some help. Would you please show me that again? and be honest with where they are in their process. And so we created a class around all of these ideas, and self-care being one of the main themes of holistic nursing. But I would encourage all of them, when they were done with their program and they get their license, to study some kind of an alternative approach, whether it's massage therapy or aromatherapy, Trager Approach, craniosacral. There are so many different opportunities for us now to learn about these approaches. And the fact is that many of the people that are coming into the hospitals and the clinics where we work, they know more about these things than the nurses do. And so we really do want to encourage nursing in general to open the field up and provide these certifications. Nurses can't be certified in holistic nursing. I'm a co-chapter leader here in Columbus, Ohio. We have a monthly nursing meeting at the OSU Integrative Center. Right now, because of what's happening, it's on hold. Nobody's meeting in person anymore. But we have a Facebook page. It's called ANACO, American Holistic Nursing Association, Central Ohio. Okay. You can find that on Facebook. We also have anaco.com, AHNACO.com. If nurses want to know more about holistic and what you're doing, we can put up some of these videos on there for people too. But I think nurses want to know, and I think taking the time to get certified in something can fulfill the requirements for our license. Every 2 years, we have to have 24 hours. So why not get trained in some alternative care or practice that would not only help your clients, but it would help you tremendously.
Oh, yes, kind of dealing with, we also as nurses go with stress and have personal ailments that we're dealing with as well. So in addition to helping patients, also like you've mentioned, help ourselves in the process as well.
Yes.
And I've seen that where nowadays, as personally practicing, I've come to realize some of these people are finding information online and getting, taking these different medicine or trying different therapies, and they come and ask you, is this helpful to me? And if you're not familiar with it as a nurse or a medical provider, you're just scratching your head.
Right. And that takes us outside of our scope of practice,
Yes.
So there are lots of ways that you can become more skilled and have the resources in your hands while you're working with people and say, let's look it up together.
Yes.
There's a lot of things that we can do that nurses don't do because of the time constraints that we have. And that is the most common complaint I hear from nurses. I don't have time to do all these things, But the fact is, if you take 1 minute right now with me and just take a breath, that would change your whole interaction with the next person you're going to see. And it will calm your heart rate. It's going to be better for you. So it really takes no time at all if you stay in the present moment. But behind the scenes, there's a lot of learning and unlearning. There's a lot of unlearning and learning that needs to happen for nurses. And I think we're in a time frame now where that is going to be more possible.
And people are becoming more open-minded about it as well, from what I'm understanding. So thank you very much, Judith, for sharing all this information. So is there a specific website that, because you have mentioned about the OSU Integrative, but something that you personally, if somebody wants to get access to getting therapy sessions with you, that they can visit?
Yeah, that's great. My website is simply judyfasone.com, and my email is simply judyfasone@gmail.com. So very easy to remember, and I'd be happy to share what I know with anybody that wants to know.
Okay, so I will also be putting all this information under the description below. So in case you didn't catch it, you will be able to go under the description and get all this information as well. Thank you, Judith, for being with us today and sharing this information. Please, guys, don't forget to subscribe, like, and share, especially share with someone who is a nurse professional themselves or medical professional themselves, or anyone that will benefit from alternative therapy, Trager practice, or holistic nursing overall. Thank you.
Yes, thank you so much. Have a wonderful night.
You too. Thank you.
Yeah.